Nigeria has the highest maternal mortality in the world, second to India. It also has the highest neonatal mortality in the world, second to India. We have about 24,000 primary healthcare centers in Nigeria, but we have only about less than 2,000 of them that are functional. So you see, we have situations where we have buildings, but we do not have, the systems that run those buildings.
Apart from that of dispensary, there's no other healthcare in Akomazi. Either we go to Omunide or Agbo or Asaba.
There are people in the community that even common Panadol can even make them to lose their life.
One of my brothers got little injury shot. So before we could take him to that area, before just go like that.
Engagements that the Primary Healthcare Board is going to lay out.
The Access to Finance framework is a very innovative framework that was designed by PharmAccess Foundation. It's a multidisciplinary framework where we are trying to find a way to bring together public and private sector to working on innovative PPP as a pathway to revitalizing the primary healthcare system. And we also know that government has limited funding and resources to get all these primary healthcare centers working. So in essence, what we've done is to bring in the private sector to take over some of these non-functional primary healthcare centers.
The first time we came was what we call recognizance, to kind of identify where there are facilities that have been abandoned, where there are challenges in terms of healthcare services, and where there are situations that require immediate and urgent intervention to bring quality healthcare to the people.
PharmAccess is very interested in health markets and making sure that there is equitable health available to all, especially rural areas. We work with state governments to develop demand creation for health, and we also work with them to enable the supply side intervention. So on the demand side, we support states to set up health insurance schemes. We advocate to governments to set aside funding to be able to pay for those that cannot pay. If you create all of this demand and there is nowhere for them to access these services, then it creates a market failure.
What if private sector providers take over these centers? What if we provide cheaper funding for them by commingling funds with the state government and Bank of Industry and give them some single-digit lending to bring down their cost of operation? What if the health insurance scheme that has already kicked off could guarantee the repayment of these loans? Essentially, what you have is a full cycle that guarantees trust.
So our role as a catalyst is to show that this can work from a job creation perspective. Secondly, it's also to mobilize capital to primary healthcare. Lagos is seeing a resurgence of capital being mobilized into the healthcare industry, but a lot of that capital is going into tertiary and in some cases secondary healthcare. So it's important to ensure that the primary healthcare infrastructure, where 80 to 90% of all healthcare cases go to, is also strengthened, and to ensure that the people in these communities have access to decent, quality healthcare.
We are now going around to ensure that the community, the leaders of the community, officially and properly hand over those facilities, giving us a go-ahead to come into their community, take over the facility, provide care, and assuring us that they will also participate in ensuring that the facilities run well, the services are good, the security is in place, and that they will monitor and ensure that that participatory relationship to ensure quality healthcare for others are in place.
We are happy that the community has come out fully to support. The facility has been officially handed over to us. Presently, we have a good building, a structure, so we intend to equip it. We also intend to bring doctors, nurses, laboratory services, pharmacies, and every other services that a hospital can provide.
Also, in partnership with PharmAccess Foundation, we are going to use a safe care methodology, which is our quality improvement methodology, to make sure that the quality of care being delivered within these primary healthcare centers is up to par. So the state government, PHCs, is PharmAccess Foundation, together with the Bank of Industry, supporting private sector organizations to reactivate and revitalize non-functional PHCs in Nigeria, starting with Lagos and Delta State as a pilot.